actually very interesting case that I recently had. A patient who had pancreas cancer and had a complete resection at the time, but unfortunately we were seeing the CA19-9 levels kind of climbing up, but we couldn't see anything on CAT scans. The patient subsequently had even a PET scan that was really not like significant. We couldn't see anything, and we ordered a liquid biopsy looking for circulating tumor DNA. And the patient was very concerned about the presence or not of this ctDNA, because that will mean that the patient may go back on chemo and or was already uh, getting tired from multiple cycles of chemo. The patient was getting kind of just trying to keep the cancer at bay. And once we sent the sample, we noticed that there was no ctDNA for this patient. So it kind of gave us the opportunity for us to say confidently that we didn't need to give this patient at least active treatment at the moment. Maybe we can give the patient the break that he was looking for, gave more validation and peace of mind to that patient. And I have another case, which was the opposite, which was someone who had colon cancer that we had not seen any evidence of disease. There was no concern about it, but we ordered the testing as well. And we found the circulating tumor DNA positive. And once we found it, then a few months later, we were able to find the disease through a PET scan, had a single lesion in the liver that actually was able to be resected. And that really helped us out to help the patient in a much more efficient and proactive way. So a couple of cases that I think are important, and I'm sure there's many more that we'll learn in the future, and registries and having all these patients on studies I think will be helpful, like the bespoke registry that Signatera has. We are opening that registry as well, so we can have better options and more data for those patients.